Alright. Hey there, NeuroClarity listeners. Welcome back to your favorite neurology learning space where the fog of complex neuroscience gets blown away one episode at a time. Today, we are diving into one of the most fascinating and important cerebrovascular diseases that you may ever encounter, Moyamoya disease. Weird name, right? Yeah, it's weird because it's rare, it's progressive, and it actually shows up in both adults and kids. And whether you are hearing about it for the very first time, or you're reviewing for the boards, or you're just curious about how neuroscience works, by the end of this episode, you will have it locked in. As usual, our case is derived from the Ching and Cheng's comprehensive review of clinical neurology. And right now, we are currently in chapter 2. This case is actually question 50. We have done questions 1 to 49. Unlike other episodes where we start with a clinical case, and this episode we are going to do something very different. We will start with an introduction to Moyamoya disease, and after which we're going to take a look at the question and then have an extensive discussion. That being said, let the clarity begin. The naming ceremony. What exactly is Moyamoya? Moyamoya is a Japanese term meaning something hazy, like a puff of smoke. This poetic phrase actually describes the tangled network of tiny collateral blood vessels that form in response to blocked arteries at the base of the brain. What exactly happens? First, there is progressive narrowing or stenosis of the intracranial internal carotid arteries, that's the ICA, and their major branches, including the anterior cerebral artery and the middle cerebral arteries. And as these vessels get occluded, the brain tries to help itself by creating a network of fragile collateral blood vessels. When you check on angiography, this looks like smoke arising from a fire, hence the name Moyamoya, something hazy like a puff of smoke. It's important for us to note that this vascular abnormality is non-inflammatory and non-atherosclerotic. That is, it has nothing to do with cholesterol plaques forming on the wall of blood vessels, neither does it have to do with vasculitis or an inflammatory process occurring in the blood vessel. Let's slow down a little. Like we always do, let us test our understanding using a real board style like question. Question 50. A 14-year-old girl comes for evaluation with a presumptive diagnosis of Moyamoya. Which of the following is incorrect regarding this condition? A. There is bilateral stenosis of the intracranial internal carotid arteries and other arteries in the circle of Willis. B. There is extensive collateral circulation seen on angiography as a puff of smoke. C. It affects predominantly children and adolescents. D. Cerebral ischemia and hemorrhage may occur. And E. Anticoagulation has proven to be of benefit in these patients. So, what do you think? Let's hold that thought. We are going to get right back to it. Moyamoya has a bimodal age of distribution, affecting children between the ages of 5 to 10 years at one end and adults between the ages of 30 to 50 at the other end. The presentation depends on the age of the patient, with children presenting with ischemic symptoms including transient ischemic attacks, strokes, and these are often precipitated by hyperventilation such as during crying or exercise. Adults, on the other hand, present with hemorrhagic stroke, often intraventricular or lobar hemorrhages. Adults also tend to have a higher risk of fetal bleeding events. Other symptoms can include headaches, seizures, movement disorders like chorea or dystonia, cognitive decline, and psychiatric symptoms. This disease is more common in East Asian populations, especially Japan, Korea, and China, but it also occurs worldwide and it has been increasingly recognized in other ethnic groups. There are two related terms, which includes 1. Moyamoya disease and 2. Moyamoya syndrome.
Moyamoya disease is idiopathic with no known underlying condition. Well, we often attribute it to a genetic cause with environmental factor playing a very huge role. And Moyamoya syndrome, which is secondary to other conditions or disorders including Down syndrome, sickle cell disease, neurofibromatosis type 1, and cranial radiation. We said something about genetic factor. While I am not going to bore us with the intricate details of the genes involved, I would just like to point out something very important. Some patients have a variant of RNF213 gene, and this gene has been linked to Moyamoya disease. This gene plays a very huge role in development of blood vessels.
A beautiful beach not far away. I went to visit for a day. Got covered with some gooey ooze that changed my DNA. Now I try to act normal, keep my cool while other kids play after school. I turn into a prehistoric hero. I'm in, I'm in, I'm in the dino squad. I'm in the dino.
How do we make the diagnosis? MRI/MRA can show stenosis and early signs of collaterals. CT angio can be helpful when MRI is unavailable. The gold standard, however, is digital subtraction angiography, the DSA, and this often shows the classic puff of smoke, which is literally the name of the disease, Moyamoya. Diagnostic criteria includes bilateral stenosis of the distal internal carotid arteries and proximal anterior cerebral artery and middle cerebral artery. Abnormal smoke-like distribution of vascular network is a giveaway, and if there is no underlying cause, that points towards idiopathic cause, Moyamoya disease. On histology, you will find fibrous intima thickening, thinning of the medial, and absence of inflammatory cells or arterioma. How do we treat? There is no curative medical therapy, but surgical revascularization can dramatically improve blood flow and reduce ischemic events. Since Moyamoya causes progressive narrowing and eventual occlusion of the internal carotid arteries and their branches, the brain gradually suffers from reduced blood flow, especially during exertion or stress. To restore perfusion, neurosurgeons use bypass surgery to reroute blood flow to the brain. There are two main types of bypass techniques. There is the direct and the indirect technique. For the direct bypass, the most commonly used is the superficial temporal artery and the middle cerebral artery anastomosis. So, what does this mean? A branch of the external carotid artery, that is the superficial temporal artery, which is located in the scalp, is connected directly to a branch of the middle cerebral artery on the surface of the brain. Think of it like building a new highway connection to bridge more traffic, that is blood flow, directly into the city, that is the brain. The key point to remember includes 1. There is immediate improvement of blood flow to the affected area. 2. It's technically demanding and requires microsurgical expertise. And 3. It is preferred in adults who typically have large vessels. It's like splicing two pipes together so water flows instantly from one to another. The second technique is called the indirect bypass, and the most commonly used has a very big name: Bracefoot encephaloduroarteriosynagosis. Yeah, a big word. What does this mean? The superficial temporal artery is dissected and leads directly on the surface of the brain without directly connecting it to a cerebral artery. We hope that over time, new blood vessels or collaterals will grow into the brain tissue from the superficial temporal artery to provide more blood flow. It's like planting a vine near a dry garden, and eventually its roots will grow into the soil and supply moisture. Key points to remember include the following. 1. There is no immediate blood flow boost. It may take weeks to months for collaterals to form. 2. This is often used in children whose brain are better at forming new blood vessels. And 3, it's technically simpler with a lower risk than a direct bypass. For adults, we prefer a direct bypass. For children, we prefer an indirect bypass or even a combination because their angiogenic potential is very high. We've talked about surgical options. What about medications? Antiplatelet like aspirin may be used cautiously for ischemic symptoms. Anticoagulants are not recommended as they increase bleeding risks in these patients. Other medications like vasodilators or calcium channel blockers have mixed results and they are not mainstay. What's the prognosis of Moyamoya disease? Early diagnosis and timely surgical referral can make a huge difference. Children generally have better outcomes after revascularization, and adults, especially those with hemorrhagic events, have a higher long-term risk. We've talked a lot, we've said a lot. Let us do a quick recap to lock it in. Moyamoya is a progressive stenosis of intracranial internal carotid artery with fragile collaterals. It has a classic puff of smoke appearance on angiography. In children, they often present with TIAs, that is, transient ischemic attack and strokes, whereas in adults, they often present with hemorrhage or frank bleeding. You have to avoid anticoagulants at all costs because this increases the risk of intracranial hemorrhage. There is no cure and it's best treated with surgical revascularization. And there is an entity called Moyamoya syndrome, which is secondary to an associated disorder. That being said, let's go back to our case. Are you reconsidering your option? What do you think? A. There is bilateral stenosis of the intracranial internal carotid arteries and other arteries in the circle of Willis. Well, that's true. B. There is extensive collateral circulation seen on angiography as a puff of smoke. That is literally the name of the disease, so that is true. C. Affects predominantly children and adolescents. Well, that's true. D. Cerebral ischemia and hemorrhage may occur. Well, that's also true. And lastly, anticoagulation has proven to be of benefit in this patient. That is false. E is our answer. And that's a wrap on today's NeuroClarity episode on Moyamoya. If you learned something new, share this with a colleague, leave us a review, and stay tuned for more episodes that bring clarity to clinical neurology. Remember, when you see a young patient with repeated strokes or a smoking angiogram, think Moyamoya. Until next time, stay curious, stay clear, and bye for now.